Hello and welcome back to Rural Health for You and Everybody. I'm Amber Sorensen, the Marketing Director at the Murray County Medical Center, and I'm here with Tom Bergman, one of our PAs in the Rural Health Clinic. Hello, Tom. How are you?
I am good. How are you?
I'm good, thanks. So, September is kind of a smorgasbord of different awareness months. So, we're going to be talking about ovarian cancer, prostate cancer, falls, lots of different things, pain awareness, and stuff like that.
Yeah,
So, why don't you give a brief introduction of yourself, Tom, for those who have not listened to one of your previous episodes, and then we can dive right into things.
sure. Tom Bergman. I'm a PA here. Been here for a couple of years. Do primary care. Um, yeah, just a variety of different things. I had some physical therapy training. Used to work for Mayo for a while. From the area. So yeah, that's those are the highlights.
Cool. So, let's start off with ovarian cancer awareness things. You have some things to talk about regarding ovarian cancer masses and those sorts of things.
Sure. So it's somewhat of a rare thing to develop, but the trouble with this is it's very difficult once you have it at a certain stage to be successful and to have a good prognosis. And the symptoms of simple things versus more serious things, the symptoms are very, very similar. A female could have abdominal pain, obviously, bloating, bleeding, fatigue. I mean, there's several symptoms that are non-specific to a number of different conditions. And, not every ovarian mass or gynecological mass is a cancer. There's cysts are much more common based on a female's age. You're looking at different things that are more likely. But there's ways to evaluate initially, and probably, the best test if a person were to have any of these symptoms would be to consider getting some blood work and probably an ultrasound. Ultrasounds can give us a little bit of a definition of kind of what the mass looks like, if it is a mass. I mean, they help us determine if there's something there or not. But it gives us certain characteristics, and based on that, we can make appropriate next steps or referrals. So essentially, it's something that you need to pay attention to if there's any sort of family history of gynecological cancers, or certainly ovarian cancer. Sometimes if it happens within a family, there are blood tests that you can do to see if you're carriers of certain genes that predispose you to different cancers. It's just something to kind of be aware of if there's anything in the family. So consider that, but essentially having these symptoms, doing something with them at an early stage, don't let it sit and worsen over several years. We can simply do ultrasound here. Excuse me, we have ultrasound services available, and if there is a need for next steps, we certainly have those referral sites somewhat nearby that we could always send people to, easy enough.
And that would probably be something like Sioux Falls, Sanford, that sort of thing, correct?
Yes, there are services available for certain things in Pipestone. We have a new surgeon that has reached out to us who works primarily out of Windham, and then of course Sioux Falls. Yes.
Cool. So, kind of moving right along into other cancer awareness months, want to dive into prostate cancer awareness things.
So prostate cancer is fairly common later in life. I would say most men that get it die with it, not from it. There is some chance of metastasis or complications with it. So essentially, we used to screen a little bit more aggressively than we do now with PSAs, which is a blood test. It's pretty non-specific. It can be elevated for different reasons other than prostate cancer, and the reason we don't do it quite as much as a standard is because it leads to sometimes some unnecessary testing. So if you're coming in and getting your maintenance evaluation done We don't always do PSAs, so just be aware of that. We pay more attention to symptoms. So, for instance, urination often or having to go several times at night. If you notice any blood or pain, obviously, we should work that up. But it's something that we can easily refer as well. We have a urologist that comes here now as an outreach. His name is Dr. Gillette. There's services in Sioux Falls, of course, if there's something a little more pressing. But it's something that you pay attention to symptoms first and foremost. If you notice these things, there's workups for them that can be done. And if there's not a clear positive finding, then we can surveil with different lab work. But it's not always real cut and dried how to handle it. It does take a little bit of patience sometimes, but it's something to be aware of. And usually, the middle ages and the 50s and later, we tend to pay more attention to it. If a man is younger than that having symptoms, more likely that it's something else, which we definitely can evaluate for.
For sure. And any, I guess, more so hereditary concern with that? I know you talked a bit about that with ovarian cancer.
Yeah, I think most cancers probably have hereditary aspects, whether it's ovarian, colon, prostate, but, prostate specifically, they call it BPH, so it's a benign growth of the prostate. It's something that happens a little more commonly. It's not necessarily cancer, but you can have a lot of the same kind of symptoms, and there are treatments for that can work relatively quickly, and then that can help reduce the size of the prostate over time with certain medications. But ultimately, if it's a nagging thing, we can try some treatments here to start with. If it doesn't have some kind of resolution, and we can rule out kind of the more concerning things, then certainly, we can make referrals for that as well.
Cool. So moving right along, what about Pain Awareness Month? I want to get into that a bit.
Yeah, I'm kind of surprised that there is a Pain Awareness Month. It seems like it doesn't go seasonally or anything. Pain management is a difficult thing. It used to be that we would treat with medications. It used to be they would call it a vital sign years ago, and pain meds were used much more commonly, and people that had some difficulty weaning off of those medications, we still see now. And after you've been on them for a long time, your body essentially almost rebuilds what is normal as far as a pain standpoint. And if you remove the medication, you have more pain. It's a tough spot to be in. We want people to be functional and do things that they need to do, and if pain inhibits that, we have to manage it. But there are responsible ways to do it and irresponsible ways. And exercise, activity, weight loss, those are very important and oftentimes neglected. Using pills to control pain is just not desirable. We actually have a pain specialist who's a nurse anesthetist here that does ultrasound guided injections for chronic low back pain, chronic radicular problems like down in the legs, degenerative disc disease, headaches, neck pain, like a lot of spinal things, which seem to be a common flavor of chronic pain. We make referrals to her on somewhat of a regular basis. I do know that she likes to have some advanced imaging done if it's a spinal problem, for instance, so she kind of knows what the prognosis is and kind of how to handle the situation. But I would much rather, have a person with chronic pains see her or someone like her to consider injections prior to being on all sorts of pills or undergoing, complicated surgeries. They're not always the answer either. And I've had good luck sending patients to her. She communicates well with us. I've found that she does a pretty good job managing these things, but there are alternatives if it comes to that. But yeah, pain, it's not an objective thing. We can't do a blood test to measure how much pain you're in, really. It's subjective, and a lot of times it gets to be a psychiatric component as well. If you think you're going to have trouble with something, you probably will. But there's lots of other things that can be done aside from meds. Exercise, topical creams, braces, tapes, lots of different things, TENS units, you know. If this is a concern for you, you can certainly be evaluated here and be given all these options. Easy enough.
Cool. Anything else to talk about?
Well, so if we talked about pain briefly, it is a complicated subject, but there's many ways to handle it, and it does kind of go hand in hand with fall risk, and that's something else I want to talk about. We don't want to fall, especially if we're older and our bones aren't in perfect shape. Having fractures of our hips or really anywhere is really not a good deal, and once it happens once, our function can get diminished, and we're a little bit more likely to have more problems, to lose conditioning, to not be able to do things that we used to do. So, preventing these things is much more important than trying to manage them after the fact. So, if balance is a concern, or extremity weakness, or vision, or any of these, you can be proactive with a lot of that. And sometimes you get lucky if you fall and don't really hurt yourself, but you don't really want to keep falling and wait for something to happen before you try to do something from a treatment aspect. So if there's concerns about yourself or a family member, we definitely can evaluate for that. We can get therapies input for it. We can start being proactive, which would be wise. There are a number of different gait aids. Of course, you see people with canes and walkers and stuff, but it's not always cut and dried. If you go to an equipment store and just buy something and you're not real proficient in it, can be kind of a hindrance. So, working with someone and kind of getting a good handle of whatever piece of equipment you might need would be smart as well.
Good stuff. Thanks, Tom, for being here.
You're welcome. So I know there's a nice fitness center downtown here connected to the dentist's office. It has lots of things that people can use for endurance. There's balance things that can be worked on. I know there's another really nice gym in Fulda that's more for like your weightlifters and things. Lots of room. I think they do, what do they have? They have an individual that does classes there, stretching classes. I believe there's yoga, different things seasonally kind of based on demand, but very nice place. Would highly recommend them. Pretty local, so I would suggest taking advantage of those things and being proactive.
Very good. And if you'd like to make an appointment at the Maury County Medical Center also, you can call 507-836-6153. That's 507-836-6153.